Indeed, you all look, what was the thing? Gender bender. I've seen Bob the Builder, I've seen Batman. Um, there's so many of you here, and I'm sure your evening is progressing pretty well. And you are all anticipating to socialize more and enjoy your dinner before you
Yes, ladies and
move
gentlemen,
along with your
our
conference.
chief guest
The
tonight is
theme,
no
Rashmika talked
stranger to
about
your
growth.
call.
Yes, for me, whether you grow horizontally, whether you go vertically, or whether you grow, but you have to grow professionally. We have to grow. And she said, if we grow physically, it's by choice, right? So whichever way, growth is very important for us. And I think for you, as a society, as professionals, your professional development, your professional growth in terms of upskilling, in terms of gaining more knowledge about the work that you do, and of course, being more sensitive about the needs of the society that we live in with new emerging diseases um, and the consequences of that. And you, as pharmacists, I think you are the solution to most of the problem that the doctors have because you also provide service to the people. So, ladies and gentlemen, first of all, thank you very much to the Secretariat for the invitation extended to me this beautiful Saturday evening. And on behalf of the Ministry and on behalf of the Fijian government, please allow me to thank all your members, all of you, for the services that you are providing to our Fijian people. It is very much appreciated. Um, like the President said, let bygones be bygones. We need to forge more stronger partnerships. We need to strengthen our working relationships as a government and as your society, or in fact anybody, anybody, and all our stakeholders that work towards improving the health of our people, whether it being the doctors, whether it being allied workers, whether it being your pharmacists, all and everybody included in the medical profession, your work towards serving all our Fijians is very, very much appreciated. So thank you very much for that. And again, mentioned pharmacies that provide for glucose testing and pressure testing. Yes, there's no legislations around it. Some charge, some don't charge. I would urge you to continue with that service. A lot of people end up in pharmacies requiring their services, and I'm sure most of the pharmacies are providing that. So please carry on with that, and we will continue to work together. Coming back to the theme of your conference, I think it's a topic that we normally don't open up and talk about, and I would like to commend you for choosing that because indeed it's always difficult to begin discussions and dialogues deemed forbidden, okay, deemed forbidden or too sensitive to mention publicly or even within our homes. So getting that bold theme for your conference, I think it's the way forward. And you're talking about reproductive health. Let's talk about sex. That for many many years, I think this is a taboo subject because of the strong cultural values and beliefs we have. Parents don't want to talk about it openly to their children, and most of the time we leave it to teachers. We leave it to the healthcare workers to talk about this. But I think everybody needs to be on board when it comes to talking about reproductive health. And we need to understand why people feel uncomfortable around such a topic and why we need to deal with it in a very sensitive manner so that we can actually open up discussions and dialogues on that. So I'm sure you and I all are here today to acknowledge the fact that there is still a barrier that exists when discussing this topic, and that we are here to take steps towards breaking down these barriers so we may end up better helping the people that we serve and, of course, our community. I don't need to define reproductive health to you, ladies and gentlemen. I'm sure you all know, but according to WHO, reproductive health means a total well being in all aspects of reproduction. Good reproductive health implies that the people have the capability to reproduce, have a satisfying and safe sex life, and have the freedom to decide when or how often to do that. Ladies and gentlemen, investment in sexual and reproductive health is fundamental to many, and in which Pacific Island countries have set for themselves to achieve equitable development. Its importance is reflected in objectives set out in the Pacific Islands Healthy Island Strategy signed here in Fiji in 1995, and again it was re-endorsed in 2015 by the Pacific Health Ministers, the Yanuda Declaration. If I may just inform you 2 days ago, we launched a program under the Australian government, DFED funding, and we are thankful to the Australian government for injecting about 46.5 million Fijian dollars, close to 30 million Australian dollars, which is one of the largest investments in our region, specifically to strengthen access to sexual and reproductive health. And the newly launched transformative agenda as part of this initiative that has been designed to respond to key needs of 6 priority Pacific countries: Fiji, Kiribati, Samoa, Solomon Islands, Tonga, and Vanuatu. And we will be benefiting from this funding from Australian government. And our focus here would mainly be increasing and improving the supply of quality integrated sexual and reproductive health information services, particularly for family planning. It will also include strengthening the enabling environment for sexual and reproductive health. Men and women should be informed about and have access to safe, effective, affordable, and acceptable methods of family planning of their choice. Everyone has the right to appropriate healthcare services which enable a woman to safely go through pregnancy and childbirth. And of course, providing access to these critical services will ensure that our people can make informed decisions about their own lives and achieve the goal they set for themselves. When they have these services, they enjoy better health, can achieve higher levels of education, expand their workforce opportunities, and generate more income for themselves and their families. Access to quality sexual and reproductive health, particularly family planning, is essential to improving an individual's health, education, and economic well-being, particularly for our women and girls. This can also play a pivotal role in strengthening national economic performance by reducing health and education costs, increasing household wealth, and enabling women to contribute equally to social and economic developments. I'm sure you all know access to family planning also helps to save lives of women and girls by ensuring that babies are not born too early, too late, or not too close together. As we welcome your theme for the conference, Reproductive Health, Let's Talk About Sex, I think it would be useful for us to reflect on Fiji's achievements to the Millennium Development Goals and the challenges yet to be overcome in meeting the SDGs. We have accomplished a great deal. Access to modern contraceptives, development of emergency contraceptives and female condoms, as well as improved techniques for induced labor, has enabled countless women to make their own decisions about childbearing. In the last 20 years, increased access to skilled care during childbirth, along with contraception, has reduced by half the number of global deaths related to pregnancy and delivery. 2 decades ago, in 1994, the Cairo International Conference on Population and Development emphasized that sexual and reproductive health is a fundamental human right. It underscored that empowering women and girls is both the right thing to do and one of the most reliable pathways to improving people's well-being. The International Conference on Population and Development also committed to putting people's rights and dignity at the heart of development, thereby making it clear that population is not about numbers, but it's about people. The government of Fiji, through its work on policy formulation and legislative reform and program implemented to achieve the International Conference on Population Development commitments, has demonstrated the importance of investing in sexual and reproductive health services. We recognize the need to ensure that all Fijians achieve safe sexual relationships, free from violence and oppression, and allowing them to control their fertility with the freedom to decide if, when, and how often to reproduce without adverse or grievous consequences. This would, ladies and gentlemen, lead to greater social and economic development for all Fijians. Research shows that a well-delivered integrated sex education program, along with equal access to family planning services, results in improved population dynamics, which in turn has a positive multiplier effect on human development and the well-being of all people. The UNFPA's State of World Population 2014 report, The Power of 1.8 Billion Adolescents, Youth and the Transformation of Future, calls for greater investment in young people to realize the potential that resides within them. More than a quarter of the world's population is between the ages of 10 and 24, with 86% living in less developed countries. These young people are tomorrow's parents. The reproductive and sexual health decisions they make today will affect the health and well-being of their communities and of their countries for decades to come. And the story is same here. It is only with proper investment in the education health, including sexual and reproductive health, human rights, welfare, young people could become the drivers of economic and social development for their communities and country as a whole. In particular, two issues have a profound impact on young people's sexual health and reproductive lives: family planning and, of course, HIV and AIDS. Teenage girls are more likely to die from pregnancy-related health complications than older women in their 20s. Statistics also indicate that 1/2 of all new HIV infections worldwide occur among young people aged between 15 to 24. As we make progress to achieve the SDGs, let us also recommit ourselves to work together to advance and protect the rights of women and girls, to again determine the timing and spacings of the pregnancies so that they can enjoy safe motherhood and childbirth, and to live a life of dignity and respect. Ensuring that every pregnancy in Fiji is wanted, every childbirth is safe, and we are able to realize that every young person's potential will make a significant contribution to achieving a better Fiji. In doing so, I think we will all commit to making Fiji a great place to live, a great place to work, and a great place to live, raise families, and to do business. Pharmacists, your cadre, are often the first line healthcare providers in Fiji. Pharmacies have always played a key role in helping people to look after their health, including sexual health, and they are often the most available healthcare outlet in communities. Women routinely visit, people routinely visit pharmacies to purchase or seek advice from pharmacists on treatments of minor ailments such as vaginal thrush, some forms of contraception, and for the dispensing of prescriptions and contraceptive products. Many men use pharmacies routinely to access condoms as well. Pharmacy waiting times, unlike our hospital waiting times, are usually short, and services including information and direct sales of medication often less costly than those of other healthcare providers. Trained pharmacists and pharmacy employees have successfully delivered care related to stigmatized health conditions, including sexually transmitted diseases, family planning, and emergency contraceptions. Their success has been due to their ability to facilitate rapid access to medication, supplies, medical information, and advice while maintaining client confidentiality. Ladies and gentlemen, in addition, there is a growing evidence that pharmacists are capable of providing sexual and reproductive health care. You have been included in various sexual health care programs around the world, including pharmacists pharmacists giving rapid access to emergency hormonal contraceptions, patient screening, patients seeking emergency hormonal contraception at pharmacies, in addition to providing medicines related to reproductive health. Despite these concerted efforts by pharmacists to make their presence felt in sexual and reproductive health care, are pharmacists truly ready to be sexual reproductive health workers? That's a question I'd like you to ask during your conference. How well do our young pharmacists cope when they attend to patients who complain about their sexual dysfunctional problems, especially in Fiji, where sex still remains taboo? Are we prepared to practice evidence-based medicine in these sensitive areas, knowing that the market is flooded with various herbal and supplement products, enticing the people, claiming to be able to boost sexual drive or performances? I hope that through your discussions in this timely conference organized by a society, you will look for answers, and of course share that with me as well, to some of these questions, and equip our pharmacists to better deal with patients needing reproductive health services. Of course, recognition of your role in sexual and reproductive health is growing. There is substantial body of literature on pharmacists' participation in this area of healthcare that has led significantly towards improved access to public. It is also time in Fiji to establish sexual reproductive education programs and sexual health clinics that incorporate pharmacists as educators. In tackling the issues surrounding reproductive health, each one of you each one of you has a vital contribution to make, and some days will seem particularly hard, but we need to go on. Like you need to grow. We should never give up. Keep moving. So, ladies and gentlemen, the transformation of our healthcare system and workforce is a journey. It is a journey that we need to take together as leaders, educators, researchers, industry partners, healthcare workers, patients, caregivers, and as individuals. Only if we share the same vision of future health can we lay a strong foundation for better skills and better work for our healthcare professionals and deliver better care for all our Fijians. The government, I'm sure, is of interest to you. Well, interest or not interest, we'll talk about that. I'm coming back to the free medicine scheme. I thought I'll keep it to the last. And of course, we have reviewed the delivery of the free medicine scheme through the retail pharmacy outlets. Through we still need to do more consultations that we need to undertake with you all and all civil servants to ensure that our people get the full benefit of this program, including your profession. This program is here to stay. I remember the first meeting when I took over office in 2016. I had a meeting with the board, and one of the things they said to me, "Can we get away with this program?" I said, "No." And they said, "Well, this was actually shoved across our throats." I said, "Well, too bad." But over the last 16 or 17 months, we've been giving it a lot of thought. And we want this program to be something that will work for both of us, the benefit for both of us, okay? And I think we've made some progress in our discussions, whereby this year's budget has allocated a significant amount of money where we are planning to allow you to purchase your own medicine and dispense it to the patient. Of course, we need to discuss how and it's going to work. But I would like to plead with the society that we need to progress in a fast manner so that we can implement the program. We are already talking about it on the table, but like I said, we need to discuss more so that we can implement this successfully. Well, this program is here to stay, and I'd like to use this opportunity to plead with the society. I make a humble plea. Let's come to some consensus and see how best we can implement this program. I think at the moment, I stand to be corrected, we have more than 30,000 Fijians who have registered under the free medicine scheme, and we continue to push for registration drives. And I think there's some misinformation out there as to what pharmacies can dispense under the free medicine scheme. Some of the pharmacists have shared these stories with me, that there are times when patients go to the pharmacy and they pick up a lot of stuff and say, "Well, this is all, I want this. Okay, I want this because, well, the government is saying medicine is free." No. But what I'd like to say is the 142 medicine that is part of the program, most of them are also available in our government pharmacies at our various hospitals and health centers. So my team is now, again, engaging with the community, trying to pass on the right information. And, well, if there's a case that comes to you and saying, "Okay, I want all these medicines, give it to me," well, then you'll have to have your own forms of advertising. But like I said, we will need to work together, okay, and come up with a way where we can implement this. And I think the feedback I got was the concern was from the pharmacists that the government will not pay on time. You can have my word. You can have my word. I have the budget, and we will make sure that you are paid for your services as and when you deliver. Okay, so that should not be a concern to you. Like I said, it may have happened in the past. You may not have been paid on time, or you may not have been paid at all. That should not have happened. But if it has happened, well, I'll make sure it doesn't happen, and I'll make sure that you get paid for the services that you've provided previously. And as we move forward, you can be assured, okay, we will have to set up systems and processes where your payments are timely. Okay, so well, if you have that concern, please put that to rest. That shouldn't be. Um, anyways, so that's all I had to say. And once again, thank you very much um, for what you do, for the services that you provide to our people. And I'm sure that you are equally as part of our medical, what should I say, the sector as any other person. Doctors, nurses, allied health workers, you are all equally part. Sometimes pharmacists are seen to be out because maybe because you run privately and stuff like that, right? But we all are part of that team that has committed to providing timely and efficient services to our people. So thank you once again. Have a blessed conference and enjoy this evening. Thank you very much.